project is on autism. So a brief introduction to autism. By the way, this logo is from Autism Speaks, which is one of the main organizations to raise awareness for autism. So what is autism, and what is autism spectrum disorder? Autism spectrum disorder, referred to as ASD, and autism are both general terms for a group of complex disorders of brain development. Characteristics of these disorders are present in varying degrees. Some characteristics are difficulties in social interaction, difficulties in verbal and nonverbal communication, and repetitive behaviors. In May 2013, all autism disorders were merged into one umbrella diagnosis of ASD. They were previously recognized as distinct subtypes, including autistic disorder, childhood disintegrative disorder, pervasive developmental disorder not otherwise specified, and Asperger's syndrome. ASD can be associated with intellectual disabilities, difficulties in motor coordination, as well as physical health, attention, and issues such as sleep and gastrointestinal disturbances. Some persons with ASD excel in visual skills, music, math, and art. Autism appears to have its roots in very early brain development. However, the most obvious signs that indicate a child having autism tend to emerge between 2 and 3 years old. So what does it mean to be on the spectrum? First, it's important to remember that everyone who has autism is unique, and all of them exhibit different qualities as well as varying degrees of the disorder. Many who are on the autism spectrum have exceptional abilities in visual skills, music, as well as academic skills. The makeup equates about 40% having intellectual disabilities, which means an IQ of less than 70. Many have normal to above average intelligence. Distinctive abilities and a unique way of viewing the world make up many of those on the spectrum. Some have significant disability and are unable to live independently. About 25% of individuals with ASD are nonverbal but can learn to communicate using other means. Some of the symptoms. To the right is a diagram showing the symptoms as well as their different categories. Social challenges. This is one of the symptoms. This includes a difficulty to engage in conversation or everyday interactions. They may have an inability to express attachment, or they may express it in an unusual way. Difficulty regulating emotions makes up many people with ASD, and they may prefer to play alone. Some have communication difficulties. This may be a delayed babbling and speaking. They may use speech in unusual ways or repeat what they have heard verbatim. An inability to understand or use body language is also a symptom. Another category is repetitive behaviors. This may include hand flapping, rocking, jumping, and other behaviors that they repeat over and over. This may also describe some that have an obsession with having objects in the right order or a fixed place. Older children and adults with autism may develop tremendous interest in numbers, symbols, dates, and science topics. Physical and medical issues that may accompany autism. Some of these include genetic disorders, seizure disorders, sleep dysfunction, sensory processing problems, as well as pica. Treatment. Intervention may involve behavioral treatments, medicines, or both. Addressing additional medical conditions can improve attention, learning, and related behaviors. It's important to remember, while autism is usually a lifelong condition, all children and adults benefit from interventions or therapies that can reduce symptoms and increase skills and abilities. Although it is best to begin intervention as soon as possible, the benefits of therapy can continue throughout life. Also included are early intervention therapies. There are two main types. And adolescents with autism can benefit from transition services that promote a successful maturation into independence and employment opportunities when entering adulthood. Early intensive behavioral intervention improves learning, communication, and social skills in young children with autism. These services are usually conducted in toddlers and preschool children. Finally, growing evidence suggests that a small minority of persons with autism progress to the point where they no longer meet the criteria for a diagnosis of ASD. Autism prevalence. So how common is autism? Well, on March 27, 2014, the Centers for Disease Control and Prevention, CDC, released new data on the prevalence of autism in the United States. This surveillance study identified 1 in 68 children with a makeup of 1 in 42 boys and 1 in 189 girls as having ASD. Why does the vaccine autism controversy live on? The ruling in each of the 3 critical test cases indicated that vaccines do not cause autism. The link was denied between the combination of the MMR vaccine and the vaccines with thimerosal, a mercury-based preservative, and the spectrum of disorders that are associated with autism. Still today, 1 in every 150 children has been diagnosed on the autism spectrum. 20 years ago, that statistic was 1 in 10,000. But the vaccine controversy can cause severe implications for American public health. But is there really a rising autism epidemic at all? Or is it just that more people have become aware and the signs have become more obvious? So here's a brief history of autism. Eugene Bleuler coined the term autism in 1908 among severely withdrawn schizophrenic patients. 70 years ago, in 1944, Leo Kanner first described autism. Before Kanner's awareness, autism didn't exist as far as clinicians were concerned, and its official prevalence was therefore 0, but obviously there were people with autism. These people were simply considered insane. In 1967, psychologist Bruno Bettelheim popularized the theory that refrigerator mothers, as he termed them, caused autism by not loving their children enough. Autism research gained momentum in the 1980s. It was increasingly believed that parenting had no role in the causation of the disorder. Here are some famous people with autism. But although autism is believed to be a newer condition, many histories and records have revealed that some notable figures in history may have been on the autism spectrum. These people include Albert Einstein, Amadeus Mozart, Sir Isaac Newton, Charles Darwin, Thomas Jefferson, Michelangelo, Andy Warhol, Emily Dickinson, and Hans Christian Ander. Here are some random facts about autism. No blood test, scan, or image can detect autism. The diagnosis relies solely on behavioral observation and screening. This is the fastest growing disability in the U.S. Autism is more common than childhood cancer, diabetes, and AIDS combined. Researchers are uncertain why boys are diagnosed more than girls. Perhaps it is because the problem lies with the X chromosome, of which boys only have one. From the Greek autos, meaning self, autism literally means alone. And finally, dogs have been shown to improve autistic children's quality of life, independence, and behavior. They tend to calm the child and serve as a link to the child's community. Autism in the classroom. Here are some tips for teaching autistic children in inclusive classrooms. First, it's important to remember that no one intervention or approach is proven effective for every child with ASD. Some important facts to consider are the child's family and their vision for their child, the student's ability to communicate, how he or she prefers to communicate, and the cognitive ability, learning style, adaptive behavior, and independent daily living skills. It's important to implement consistent classroom routines. This lowers the anxiety level and increases the ability to function. Next, visual instructions, rules, and schedules. The visual strengths that children with autism have increase their ability to function independently and both academically and socially. Again, watch for signs of high anxiety, stress, sensory, or emotional overload. This may be indicated by them putting their hands over their ears, plugging their ears, squeezing a body part, or repetitive behaviors like rocking. It's important to allow these students to go to quiet areas to unwind. Children with autism also need frequent breaks. Visual reminders of transition times and activities may also help. Structure the layout of the room with visual signs. Highlight directions, number the steps to complete harder tasks, and give an example of the completed task. Also, assign individual roles for group work. This decreases confusion. This is a visual that I found, the Autism Helper, and it's 7 steps for setting up a stellar autism room. Step 1 is organization and planning. 2, classroom structure. 3, schedules. 4, visuals. 5, data. 6, work tasks and IEP goals. And 7 is communication. I find it really necessary through all of my findings that it's important, especially for just organization in the classroom for children with autism. So some activities to improve organization skills. Again, routines and procedures, and even for homework and long-term assignments. Some ideas. Laminate daily schedules to tape to a child's desk or place in front of their notebook. List out tasks and work to be completed throughout the day. Create a color coding system for pocket folders or binders in each subject area. And another idea, remind the child to check supplies and keep a supply list handy to ensure that they have everything they need daily. And a few key points to keep in mind. Some children with more severe forms of autism may exclusively be educated in a different school or a special education classroom. Children who are able to do so may only be pulled out of class for small amounts of time or part of the day. This time they may spend working one-on-one or in small groups with a teacher specializing in teaching autistic children. Milder forms of autism may allow a child to remain in the regular education classroom, only needing some of the special accommodations that I previously mentioned. And finally, the goal for any child with a disability is to remain in the least restrictive environment that is possible. Here are my works cited pages. And that is all. Thank you for watching.